Hi everyone. Every practice has patients that are of the emergency nature. So the patient comes in, you do a limited exam, and either treatment is done or it's not done and the patient leaves. Most practices have an opportunity to convert those limited exam patients into regular patients by inviting them back into the practice and doing a full comprehensive exam on them. And the difficult part is finding those patients whom you saw them on a limited basis, but never really saw them on never really completed a comprehensive exam. Practice by numbers makes it easy for you to do exactly that. So let me show you how to do that. Use all of this Revenue IQ. You go into Revenue IQ. So let me click on Revenue IQ, and there is a macro exactly for that purpose. So click on the macro, and here it brings up emergency exam, but no comprehensive exam. So I'm going to click on that, and it's going to autofill all of the things we're looking for. And what we're saying is they completed a 140, which is what an emergency exam is. Now, if you use a different emergency code in your practice, you can just select the code that you want. Okay, I'm going to leave it as it is. And the other thing that I'm saying is I want to look at the patients that I saw in the last 1 year. So the state is by default in the last 1 year, but you can change the state to whatever date you want. If you just look at the emergency patients in the last 1 month, you just make the date to be starting at last month. The other thing we're looking at is services that have not been completed. There's a recall, comprehensive exam, and some other codes that we have selected here that these services have never been completed, and these services have not been scheduled either for the next, I think it's 3 months over here, but you can change that as well. And I'm going to change this to no limit, last contacted. And I'm also going to say, just don't show me any patients that are already coming in for the next 1 week, because I know those patients already. And I'm going to hit search. Here, in this particular practice, there are 124 patients in the last year that came in for a limited exam but did not get a comprehensive exam done. Doctors, imagine the opportunity here that if you can bring even a third of these patients back and make them your regular patients. And like with everything else in Revenue IQ, if you click on this little button, it will give you the whole list of where these patients, what the opportunity is, if there's any treatment plan. For example, with this patient, there was quite a large treatment plan that didn't get done. This will show you any other appointments that are there. So this patient is coming back sometime end of March for a filling. Now that would be an opportunity to convert this patient into a regular patient. Let's look at another one. Here is another patient that came in for an emergency exam, and the patient is, let's say if there's an appointment, is not coming back. So now this would be another person that you should pick up the phone and invite them back into the practice. Okay, so use this Revenue IQ macro to find all these patients and call them back. Like with other videos, there's other filters you can add here as well. You can add if they have any benefits remaining, if they have any account balances right here, or if you want to pick a particular insurance or deselect a particular insurance. Let's say if you pick the insurance company, you can say, let's check this one, and we can select all. And let's say you do not want to invite patients back from one particular insurance company. Let's just pick CAS, meaning I don't even know what the CAS insurance company is, but just to give you an example, if you want to exclude one, you could do it like that. Okay, and I can go back here and hit search again, and now it'll give me patients that are for those insurance company that's not CAS. All right, hopefully this video was helpful. Give us a call or send us an email if you need any more information about this.